worked in Leipzig, in another town, and we had started there the TSC clinic, and we are still seeing a lot of TSC patients also here in Heidelberg, and we are very much involved in the questions related to the family group and to also TSC research. And I'm happy to have been asked to share my experience with everolimus and mTOR inhibitors, and also with epilepsy in many TSC patients. It's about the effectiveness and about the knowledge about everolimus and mTOR inhibitors in tuberous sclerosis for the indication of epilepsy. And actually the main answers have come initially from the Access-Free trial. There have been actually a German small study already in 2013, so it's about 7 years ago, where Dr. Wiegand from Kiel, he had first introduced everolimus for the treatment of epilepsy, and already in this small group, he has shown and he has seen that there is about half of patients having an improvement from everolimus treatment regarding their seizure frequency and also regarding their seizure-free days, their seizure-free time. So already this preemptive data was quite positive. And then the Access-Free trial, where we all know about, it was published like 4 years ago, and the data on the pediatric population was published like 2 years ago, has very much shown that everolimus, as the main mTOR inhibitor in this trial, helps significantly to reduce seizure frequency in all patients with tuberous sclerosis. And there were about 300 patients below the age of 18 years, and they had all received a placebo or the mTOR inhibitor. And it was pretty clear that in the treatment group, there was a decrease of seizure frequency up to 50% in patients. There were also several patients that became seizure-free. So with this data, everolimus has been then approved for the treatment of, let's call it, focal seizures mainly, which is the main indication for most of the novel drug treatments. And this is still the current knowledge, where we know that everolimus can be given to partial, mainly focal dyscognitive seizures in tuberous sclerosis patients, and especially also in children from the age of 2 years or above the age of 2 years. And this is still the current improvement we have in all over Europe. And given this, also we have some limited experience in treating younger children and in treating also infants below the age of 1 year, and especially in treating infants with West syndrome, with of course a very, very severe and problematic epileptic encephalopathy that occurs in about 30 to 40% of children with tuberous sclerosis. And regarding West syndrome, the data is still very, very limited, and our knowledge about the efficacy of mTOR inhibitors in West syndrome is still very limited. And there is only preliminary data from very small cohorts. There has been one report from the group of Vienna that has been shown that everolimus might be helpful as third-line treatment after failure of, let's say, steroids, or after failure of vigabatrin, which are usually used first. And in a very small cohort, they had reported that for male children, for infants, they had used everolimus with quite positive effects for the treatment of West syndrome. And 2 of those 4 children, I think, had become seizure-free within a few weeks. There was also an improvement regarding the EEG patterns. But still, this is a very, very preliminary result data, and has to be confirmed, we think, in larger trials. We ourselves, we had collected all the data from German children, that were 17 young children below the age of 2 years that had been treated with mTOR inhibitors, everolimus in general. And there were actually, our main interest was to know, is there difference between the occurrence of West syndrome in patients that had been treated with everolimus before the age of 5 months and after. And actually what we had found, and where we still don't know what does it mean in the end, is that also in the group where children had received everolimus very, very early in their life, which means before the age of 5 months, still 3 of about 8 children have developed infantile spasms. We cannot draw final conclusions because there was a wide dosage range for all of the patients, but we still see that even if you get everolimus or mTOR inhibitors very early in life, you can develop infantile spasms. So what is our main question for the future is to collect larger cohorts and to study with a prospective design, is there really a decrease in the occurrence of West syndrome, in the occurrence of infantile spasms, and of course in the occurrence also of developmental problems of autism spectrum disorder, of intellectual disability in children that have received everolimus very, very early in life. And this is a question that is quite similar to the questions that have been asked in the EPISTOPE study, and I think we will have a lot still to do to learn about the effects of vigabatrin for sure as prospective and prophylactic treatment, but also especially about the use of mTOR inhibitors, which are specific and precision medicine in tuberous sclerosis in the future. So we are happy to share all our data and to study this in a future prospective trial. We just asked the German government for funding for a study like this in the future. Is there actually a specific type of seizure that can be treated with the mTOR inhibitors? And the answer is, so far we don't know. There is still too few data to exactly answer if everolimus can help in a specific type of seizure. The main answers come again from the access-free trial, and there was a reduction in the seizure frequency, especially in those children that had focal dyscognitive seizures, or let's say seizures with a structural, with a focal origin, and with a complex epileptic seizure type, where also the awareness was decreased, and where also like other, not only motor components of the seizure were seen. So in this group, which was also the largest group in this trial, they have seen a decrease of about 50% again, which is a pretty good result for an anti-epileptic. So we can be certain that especially in those focal dyscognitive and complex focal seizures, everolimus does help, but also in all other seizures, it has been shown that it helps, but the data is very, very limited on a small number of patients, because the remaining epilepsy phenotypes or seizure phenotypes, like generalized seizures or like only motor seizures, were represented only in very few and minor groups. And also all the other studies, like one study from China last year, has not very much differentiated between the different seizure types, and there are so far no subgroup analyses have been made. And again, this is exactly the same for the infantile spasms. As I said before, we have only very, very few data, and we need to collect more data, and we need to apply better study designs in the future to see if there's really a different outcome regarding different seizure types, which can of course be the case, as we know from many, many other anti-epileptics, that they have a specific possibility to treat specific seizure types. But so far this data is limited, and given the specific nature of the treatment and the physiological effects from the mTOR inhibition, it might be the case that it is helpful in all the seizure types, but maybe just in combination with still other medications. We will see in the future. And I just can tell a bit about our experience with the mTOR inhibitor treatment in very young children. And we have published this last year in the Orphan Journal of Rare Disease, and it was a group of 17 children we had collected from all the TSC clinics in Germany. So we are very happy to have this this family group and this project where we can connect with all the other TSC clinics here in Germany. And this is a very, very good platform for exchange and for learning from each other and to share the experience. And we have seen in this group of 70 children, which kind of represents likely most of the German young children that have been treated by the time with everolimus, that it was overall very, very well tolerated, and that there were only very few and minor side effects, and that it helped in most of cases, especially for sure, as we know, in the astrocytomas, the giant cell astrocytomas, and also in the angiomyolipomas of the kidneys, and also for sure in the cardiac rhabdomyoma group, which is still a group where we need to know more, because as we all know, also the rhabdomyoma tend to decrease in size completely on their own without any treatment. So this still needs to be answered in the future if we really have to treat all the children with cardiac rhabdomyoma, or if we can spare still many of them, because they will decrease on their own, the cardiac rhabdomyoma. But overall, the efficacy and also the safety profile of the mTOR inhibitors in the very young children are quite good and quite positive. So I think most clinicians should not have fear to use them early during the course of disease. But also, there are no wonder medications, and we have to be very cautious about possible side effects. And we have to share the data and the still limited knowledge with other colleagues to learn more in the larger cohort of young patients. And we are happy to share our results, and we are happy to get the results of all the German patients. And if somebody was treated with everolimus in Germany, we are happy if he can inform us about the results. Okay, thank you very much.